Our next speaker is the United Nations Deputy Secretary General, Ms. Amina Mohammed. Please join me in welcoming her to deliver a keynote address.
Thank you very much. Well, first of all, this is an incredible pleasure to be here with all of you, and really deep appreciation to my sister, the permanent representative of the state of Qatar, and of course my brother from the permanent mission of Nigeria. UNFPA has been doing amazing work in Nigeria and many other countries, so thank you for bringing all of this to the spotlight, because that's really what we want to see. This is something that when I first joined the United Nations and I was asking the Secretary General what are the things that he really wants to focus on, and one of the first things he talked about was mental health, his own personal experience and those who helped in his family, his work as the Prime Minister. And so today, just having an organization that works at the grassroots, Neem Foundation, with us and sharing some of their experiences, building on what we've done over the last 2 weeks, which is to launch our strategy to bring mental health really into the fore, that it becomes something that is not in the shadows anymore, or behind the screens and faces of people who smile but yet are so broken inside and are just looking for us to help. So for too long, much too long, mental health, and we've heard today, has been left out of discussions, and it's been left out of our capitals and cabinet tables because of the stigma, and sometimes because governments have choices, which part of the health burden do they take, and very often this gets left behind, but also in communities. And as the permanent representative said of Nigeria, it is around the world. This is a universal challenge for all of us, and so therefore the framework of the SDGs makes it even more relevant to us now that we have an opportunity to engage. I was reading some of the statistics, and they were talking about 1 in 4 of us likely to experience a mental health episode in our lifetime. And this really shouldn't be the norm. As we launched the strategy for mental health amongst the UN staff, and I supported by going to a workshop the other day, and it was about stress management. And I think within the first 10 minutes I had to own up I was probably the most stressed person in the room. But on a very serious note, for me, the fact that room, 90% of that room was young people, young staff, and 90% of it was women. And it said 2 things to us, that really the stress for a young person joining the UN, at this stage we need to do something about it. But when I looked at the 90% of women, I thought, well, how many men are not here? Because perhaps it's not the thing to do as a man to come and to wear your heart on your sleeve and to open up about some of the issues that you actually face at work. So that was, for me, a big eye-opener, and one that puts more urgency for us to, shine a light on this issue and do something about it. So the tide is shifting, and mental health is becoming much more visible and a piece of what we do every day. We hope that we can share even more. I think what we really want to see are results, and that whole shift across everywhere. The paintings and photos that are featured in this project remind us that today's rising levels of crisis and conflict will leave scars, and often they will be invisible for years and years to come. Increased levels of depression, anxiety, post-traumatic stress disorders, all associated with conflict, stand to perpetuate society's instability and the cycles of conflict. And so it's not just about the day after reintegration or building new schools, homes and villages, but how do you rebuild a mind that is so broken? How do we actually help to heal those minds and to make them truly a part of our society again? And the numbers are enormous. And for each one, I think, we have to remember that extends to a family. It's not just about the person, it's about everything and person around them. So it is central to the Secretary General's peace and security agenda. It's why the work of UNFPA and the Neem Foundation are so important in countries like Nigeria, in South Sudan, in DRC, many of the places where this is the unspoken crisis, I believe, that we have to take as we look for peace. Young people are going to be a crucial piece of the equation, and as they are peace builders, are change makers, we also have to remember they're survivors, once upon a time victims, but survivors, and they have strong, healthy aspirations, and we need to make sure that they are part of trying to address this challenge. Again, the statistics, 1 in 5 of our youth experience a major health episode. That's just one too many. of 5, and we need to bring a 0 to that. So working young people into the mental health strategy and the youth strategy that was launched last month at the GA is important. Now we need to operationalize it. We really need to take that into our country teams, socialize that amongst our government colleagues and the private sector partners that we have, so that we can take a human response to this. Our commitment, of course, as you see, anything that you've got to do or say about mental health, count us in. We will be here. We'll lend our voice, our muscle to it. As I said, the SDGs provide a really great framework for this, and I hope that this will encourage us to speak more, to show more about this, and to invest more in mental health as a part of our universal health care coverage. So thank you very much.
Thank you for your powerful remarks.